Welcome to JB Asare Stick. WHO has established that over 3 million Ghanaians suffer from mental and neurological disorders, and about over 600,000 have very severe mental health conditions worth treating. Indeed, the treatment gap is about 98%, which means that we are only able to treat 2% of the Ghanaian population. The enactment of the Mental Health Act 846 and the inauguration of the Mental Health Authority Board has been regarded by many Ghanaians as well as international bodies as in good direction to salvage the image of Ghana and mental health delivery. On March 10th, 2014, Human Rights Watch, based in Geneva, after its sensational and negative report on mental health practice in Ghana 2 years ago, wrote, and I quote, "The government of Ghana should ensure that the newly formed Mental Health Authority closely monitors all mental health facilities to end the widespread mistreatment of people with mental disorders, overcrowding, and insanitary conditions. Indeed, some have said that suffering from mental illness in Ghana is like a death sentence." My eminent colleagues, Dr. Kwesi Osei, who is the acting CEO of Mental Health Authority, and Dr. Sami Ohene, who is the head of Department of Psychiatry, University of Ghana Medical School, and I will discuss the following. The new Mental Health Act 846 in transforming mental health care in Ghana, and what Ghanaians should expect within the next 3 years. We also discussed what has been done so far in the implementation of the Act and what challenges have been encountered and how they are being addressed. We also look at how we are going to have sustainable funding to bring about these changes. We'll also discuss how the practices of mental health institutions, and particularly by some faith-based and traditional healers, are going to be monitored to prevent abuses to psychiatric patients. We end up looking at whether Accra Psychiatric Hospital should be closed down. As we all know, we are emphasizing on community care. And as the Accra Asylum epitomizes primitive 20th century psychiatry. Okay, we'll be back shortly to start the main discussion. Please stay on with us. Welcome to JB Asare Stick. Now we have with me in the discussions Dr. Kwesi Osei, who is the acting CEO Mental Health Authority, and Dr. Sami Ohene, who is the head of department, Ghana Medical School, Department of Psychiatry. Now, the first question goes to Dr. Kwesi Osei. What do we have in the new Mental Health Act, which is different from the NRCD 30?
Well, thank you very much. What we have in the new acts, there are many things that are really different. The old law sort of laid emphasis on institutional care and very little emphasis on human rights.
Yes.
The new act lays a lot of emphasis on human rights and community care. We are trying to remove emphasis on institutional care to the community care. Again, the new law also brings in traditional and faith-based healers. In other words, it makes our culture very relevant to mental health care. Yes, it also ensures that it has within it a funding mechanism, and I think these are very important differences between the new act and the old law.
Okay, good. Dr. Sami Ohene, sorry, if we have to come to you, what do you think, or how do you think that Ghanaians will benefit from this new law? What are your perspectives on this?
Well, I think that to begin with, it's in line with modern trends, and hopefully it will make people realize that the mystic ideas that they have about mental illness will be a thing of the past. People will recognize that right in their communities, people with mental illnesses can be treated successfully. And they will also recognize that maybe the faith healers and such, even if they have to go there, they don't have to subject themselves to maltreatment or abuse, as we know currently happens.
Yes. Dr. Kwesi, when our colleagues in Europe and other countries were trying to move into the community, it was done in a way that had a lot of problems. If you speak about community care, what in the law, what does it mean? What are we going to do if you want to emphasize on community care? What does it involve, community care? What does it mean to us?
Right, let me just, the European approach was that they decided that they would close down all institutions, all facilities, and move into the community. Even that they realized that they were really not prepared. We are not completely closing down our institutions. Our institutions will be there, but we will still move into the community and ask what are the measures that will be put in place to ensure we have the community care. What we'll do is that every regional hospital will have a psychiatric wing. Just as if you go to a regional hospital now, we have a gynecology department, we have a surgical department and whatnot. We are also going to have psychiatric department, a small wing of just about 10 to 20 beds. So that's for the regional hospital. And then you go to the district hospital. There we are not going to create beds, we are not going to create wards, but we'll have dedicated beds within the general wards. And then you also have lots of community psychiatric nurses within the communities. We'll have community mental health officers, which are a special care of mental health care in the communities. And all this will ensure that the care is now removed from, or the emphasis is removed from the big institutions as we have them into the community. And these are some of the measures.
Yeah, very good. Dr. Ohene, well, if I had a patient at home, we are saying community care, we are frowning on institutional care. What do you think could be done to allay fears of Ghanaians that their wars in the homes can be taken care of?
Yes, well, to begin with, the patients who come to the hospitals originally came from homes.
Yeah.
So I don't think that people should be too worried. My concern immediately is about whether we have the manpower to be able to deal with the situation. Because community care or home care requires quite a number of people, different disciplines, social workers, the community mental health officers Dr. Asare talked about, and we don't have enough psychiatrists, but even the nurses who will go to the homes, we need quite a number of them. I suspect that in the beginning, a lot of these people will still have to maybe go to the hospital to begin with. The difference is that they need not come to a psychiatric hospital, yes, but they can go to a district hospital or a regional hospital. And also that most of them will not be admitted as the expectation was before. Yes. If we have enough supply of medication and enough education, yes, of the people, the relations, then I don't think that there should be a problem. They should be reassured. These things have been done everywhere else, yes, so we should be able to do it also.
Yes. So that we're going to have a lot of trained nurses, community psychiatric nurses, yes, and all that. Yes. That will be closer to the patients where they live. They'll be closer to them, so they can call on them all the time.
Precisely.
For help. Okay. Dr. Kwesi say, there is stigma attached to mental health or mental illness. This new act that we have, how is it going to address it? Do you see any ways that the new act, I think there are some ways, yeah, can you let listeners
know? To start with, stigma often comes because we fear the patients. And we fear the patients because we don't know that they can recover and they can be normal and live with us. And we don't know that because we've not been given the education.
Yes.
Now the law puts a lot of emphasis on public education.
Mm-hmm.
Public education, yeah, through the media, one-on-one, we go to schools, we go to homes, a lot of education. In fact, we are going to have a whole department devoted to that. So as we educate people and they get to understand that, oh, after all, they are like mental illness, like any other illness, the stigma will go down. But not only that, if you educate me that the mentally ill is not dangerous, and yet the practical reality is that my ward became mentally ill and is chasing me, then you will not be doing well. So again, the other aspect that the law has is that as we are treating patients in their homes or close to their homes, we see them improving every day. We will agree that indeed they are not as dangerous as we thought. So that will make the stigma go down. They come, they are working, and we can engage them in their productive ventures.
Yes.
And people will begin to see that the stigma is really going down. So there's a lot of provision in the law to ensure education. The other aspect, now, even if you say we should educate, where are the people to do the education? But again, and I tie that into what Dr. Ohene said, the law will ensure the production of human resources.
Good. We'll come
it has
to that.
Within the mechanism.
We'll come to that.
So once we have that, the stigma will drastically go down.
We'll come to that very soon. Yeah, Dr. Samuel Ohene, in terms of being able to sustain our patients in the community, vis-a-vis manage them in large institutions, what has that done to us? You remember we started with Asylum, yes, and now we are moving Asylum. So what has Asylum done to you that you want it to go away?
I think the whole idea of an asylum is based on, first of all, in the past there was no reliable or effective treatment for many of the mental disorders. And therefore, the idea was to keep them away from the public and the public away from them. Sometimes we talk about maybe the patients being potentially harmful to other people or to themselves. So it was a place of refuge. But since we now have effective treatments, then the whole idea of ostracizing somebody or removing him does not even arise. And we should now look at it as a hospital, as a place where somebody who has a crisis is treated. Just like if you have a typhoid fever or if you have pneumonia, you go to hospital.
Yes.
If it's very severe, they may admit you for a few days. If it's not so severe, you get outpatient treatment.
Right.
The thinking should be the same. Mental illness is just a category of illnesses like how cardiovascular illnesses, metabolic illnesses. It so happens that this one affects the brain and behavior. If we look at it that way, then we will understand that we have graduated from asylums to hospitals, special hospitals, as psychiatric hospitals, but now like any other hospital.
Good.
The same way we don't have separate hospitals for only chest diseases in Ghana yet. Maybe we'll get there, but for now we want to be able to recognize that this is one of the many disorders that people suffer from, and that it is, in fact, the good thing about this one is that it's not infectious. So even the issue of separating it like tuberculosis patients or Ebola does not even arise. Yes.
Good. So you agree that what the law seeks to do by creating wings in the districts and the regions?
I think it's an excellent idea. Right. In fact, you may be aware that Kolebu Teaching Hospital is currently about to open a ward, for mentally ill patients, just like any other ward. So I think we are getting there.
Okay. Now, Dr. Akwasi, I'm coming to you as the acting chief executive. What have we done so far in the implementation of the Mental Health Act since the inauguration of the board last year, November last year? What have we done?
What the board has done now is, and people may not see, I give the analogy that if a woman is pregnant, you will not see the baby until the baby is born.
That's right.
So we've been doing preparatory work. For instance, in Ghana, our law implementation, our law writing is that you have the parent law, or the substantive law, and then you have your LI, legislative instrument, which defines exactly how the parent law is to be implemented. And so what we've done so far is that we have quickly moved to drafting, there's a technical draft of the LI, and that has been completed. It's been sent to the Attorney General, and we are hoping that by September, and then latest the end of the year, you'll have the LI. So once we have the LI there, which spells out the details of the implementation, that means that will be a major milestone. That is one that has been done. And then We've also begun the process of establishing the mental health fund, which is going to be the lifeblood of the new act, and that's also statutory in the law. So that is also being done. And then we are also looking for currently accommodation for the seat of the authority.
Yes.
We've identified quite a few areas.
Yes. We're saying that the authority should be visible, isn't it?
It should be visible,
yes.
because we cannot be hiding at the Accra Psychiatric
Right.
Hospital or sharing the same property. We should be distinct. And that is being done, and hopefully by the end of, let's say next month, we will have our own seat. We are trying to, in fact, we have what we call the committees of the mental health board. And the committees are going to be like the instruments, major instruments towards the implementation of the law. And that has also been done. Very shortly, very soon, we are going to have regional coordinating committees of the mental health authority. Once we have them, then we are really decentralizing. We don't want to sit in Accra and be doing everything. So you have the regional committees coordinating all mental health care in the regions, and then we go down further to district committees to coordinate activities. There are other structures that will be formed very shortly. These are the mental health tribunals, and then mental health visiting committees.
Yes.
Tribunal may bring to mind maybe some memories, but we are not talking about that. These are actually quasi-high courts, which will ensure that patients' rights are not abused, and the visiting committees to go around to make sure that patients are treated in dignity, no flogging, no starving, these kinds of things. So we are really actually on the ground working.
That's right. I think we done a lot of things. You had a plan, isn't it? You have a mental health plan.
We have a strategic plan.
A strategic plan, and that 4-year plan. And that plan, you had to invite the National Commission on what?
Yeah, we had the National National Development Planning Commission, and also the Public Services Commission. Because we wanted to be sure that our plans are in alliance with the national aspirations. So that was done. Good. So that has been beautifully done. We've also actually visited some prayer camps.
Yes.
We visited prayer camps in the central region, because the law says that now that we have it, there should be no chaining, there should be no flogging, no human rights abuses. So we needed to visit the prayer camps to see what they're doing. We are not going to ban them, but to be sure of what they're doing and how we can support them to do what they're doing, the right thing they're doing, and to discourage the wrong things they're doing. Yeah. And that has also been done.
Dr. Ohene, when we talk about visiting prayer camps and all these people, they are always afraid. They think that we want to take over their jobs. We want the right things done. Yes. So what would you say to these faith-based healers and traditional healers about our involvement with them?
Okay. I think that we should all understand that laws are made for the betterment of the populace. And this law, after deliberation, and I believe some of them were involved even in the drafting process, it's a good idea to bring everybody who treats illnesses under some kind of authority. And it's also a recognition of what they do. Now, but having been recognized, you must have rules and regulations. And you cannot do anything that is at variance with the Constitution of Ghana or the laws of Ghana. The law says quite clearly, for example, that you cannot chain an individual. And I think that under no circumstance should any of them chain people. If they are driven to the point where they are unable to control them, it means that they are not equipped to be able to look after such patients, and should send them to places where they can be looked after. The hospitals have ways of restraining patients without chaining them, and that one, I think, should be enforced. They should not feel threatened. People will still go for prayers. Ghanaians are very spiritual people, religious people. So they'll go for prayers. I don't think anybody says people should not go for prayers. But we should seek treatment that is effective in dealing with the patient's conditions. And I think that one, there should be no compromise as to how it is managed.
Okay. Thank you very much, colleagues. I think we need to go for a break, and then we'll come back to discuss the issues further. So, yes, for those of you who might have forgotten, J.B. Asare, I used to be the chief psychiatrist, Ghana Health Service, and retired now I'm Professor J.B. Asare, who is an associate professor at University of Development Studies. I'm also the chairman of the Mental Health Authority. I've been doing a lot of things, teaching and moving around, consulting. But this program is really to educate you. That's why we brought my seasoned colleagues, Dr. Akwesi Osei, who used to be the chief psychiatrist immediately after me, and who is now the CEO, almost the CEO of the Ghana Health, of the Mental Health Authority, and Dr. Samuel Ohene, who has a lot of accolades, and he's a seasoned consultant psychiatrist. So please, we'll continue with our discussions. Dr. Akwesi Osei, the Mental Health Authority has not been selfish. It has also been supporting other non-governmental organizations and quasi-governmental organizations. Can you tell us a bit about this before we go on to our handicaps?
Well, the law actually mandates the Mental Health Authority sorry, to be responsible for mental health care throughout the country. That means that there are some institutions that are directly under the mental health care, under the authority, and there are some other institutions that will not be directly under the authority, but the authority will collaborate very closely with them. Now, the psychiatric hospitals, currently there are 3 of them, they are directly part of the authority or under the mental health board. Any future psychiatric hospital you will build as a standalone facility will also similarly come under the authority. And so the authority has been assisting them. You remember a few months ago, the nurses at Accra Psychiatric Hospital went on, well, they sit-down strike because they didn't have funding. And the authority had a little funding, so we gave them some loan to assist with purchasing of medications and whatnot. So that was done. Now, the other agencies like
CHAG, yeah,
that is a Christian Organization of Ghana, NGOs, basic needs.
Yes.
We are going to have the teaching hospitals. These are not directly under the authority. Yes. But because they will be responsible for mental health care in their own rights, right, so the authority will work closely with them. Right. And wherever you need to give them helping hand, we'll give them helping hand. Again, for instance, we have the epilepsy, Fight Against Epilepsy Initiative, which is being done by the Ghana Health Service. So again, the authority is very closely collaborating with the Ghana Health Service so that we spread epilepsy care nationwide. Good. So it will no longer be the preserve of only specialists, but any practitioner will be able to. So a lot of activities are going on. And recently we went to Nyankumase in the central region, and we realized that the living conditions of the patients there actually are not good enough at all. Yeah. And this center has really been the black spot in mental health care in the country. Universally, I mean worldwide, people come and see it, and they are really condemning us.
And the death sentence.
The death sentence, when they said death sentence, that specifically was the place they meant. Yeah. And we are collaborating with them. We are even looking at assisting them to put up some structures so that their patients will no longer be in the sun, in the rain, and so that kind of collaboration is going on.
Okay. Dr. Samuel say, when we're talking about some areas, you were talking about some of our handicaps, challenges, and you hinted on human resource. Can you tell us more about human resource development? I can give you an anecdote. When I was a chief psychiatrist, I had students, psychiatry students, coming to me, medical officers, wanting to study psychiatry. And then they went to their mentors and they were told, hi, psychiatry, why do you not have anything else to do? What are some of the problems that is mitigating against our human resource development?
Well, first of all, we need a whole range of people, as you're aware. We need psychiatrists, we need psychologists, we need social workers, we need nurses. Now, talking about psychiatrists, I think that it's important that we make the practice of psychiatry attractive to the medical students. I have had students come to me to say that their first love was actually psychiatry. However, like one of them put it, when I go through the Accra Psychiatric Hospital and I imagine myself spending the rest of my life there, it was too much for me to take.
Right.
So he ended up being an eye specialist. I think there are many people who may not voice it out, but who actually find psychiatry fascinating. These days that the Medical and Dental Council allows people to do part of their house job training in psychiatry, a lot of them are gaining better insight.
Right.
Just last week, somebody who had done 6 months with us and is now in general practice came back and said that he's so happy and grateful that he had the opportunity to do psychiatry. He says that going back to his practice, all the patients want to see him. They don't want to see the other doctors, because he is able to understand that when people are saying one thing, there may be more to it than they mean. So we need to be able to train people. So we should create the conditions. I may be biased, but frankly, I think that if people are running away from psychiatry because they find it stressful or difficult, make it more attractive for them to come. Pay them more money.
Yes.
I don't think there's anything wrong with it. Make their conditions such that they may, for example, go on retirement earlier than other people, but on a pay that takes into account maybe the expectation that you would have worked maybe 5 years beyond the time you are going. In other words, if you retire at 55, you will get the benefits of somebody who's retiring at 60, say. But I think that people should be paid more money. You cannot have a situation where you have less than 20 psychiatrists for a population of almost 25 million.
Right. We are 18, in fact.
And yet, there are, hundreds of people who are specialists in other fields. So I think we need to do something to close the gap urgently. Similarly, we should urge the School of Social Work and the universities to go into training psychiatric social workers. We don't have enough, and we should strengthen the social welfare department. We should have people who will be able to educate the general populace in psychiatry. So we need people who are knowledgeable in mental health. And this can only come about with more and more training.
Yes.
Because the education is crucial.
That's right.
Employers have to be trained.
Good.
So that they understand that the fact that somebody has had one breakdown doesn't mean that he cannot do his work anymore.
That's right.
Unless they see it in practice, they will not be able to appreciate it.
Yeah.
And the authority should ensure that the basic things that people need, medications, for example, are available. Good. So that they will see the difference between those who come for treatment and those who stay at home. Yeah. Once the message is clear and people can see these things for themselves, I'm sure that things will begin to change.
Beautiful. In fact, the Act actually takes care of some of these issues about discrimination, workplace and all that, even marriage and all that. But Dr. Kwesio say, as you can see, most of our young boys, they went to Ireland and other places. They are consultants now, and none of them, a few of them have come back. So we decided on training middle-level personnel. What is your take on this? What have you seen? Is that useful, what you are doing?
That is very useful. To start with, not only mental health, but health generally. The future of health is actually with a middle-level cadre. Yeah. I mean, that's the plain truth. It takes a very long time to train a doctor compared with training the middle-level cadre, the physician assistant. And in the same way, if you come to mental health psychiatry, it takes a much, much longer time to train a psychiatrist than, again, the middle-level cadre. So we have a certain cadre that we are calling, or we call clinical psychiatric officers. These are physician assistants who have gone for further training, and that training is being done at Kintampo. So far, we've trained 3. We are currently the 3rd or 4th batch. The first batch, there were just about 7. Second batch, 6. And the third was 5 or so. Now we have 34 people who are enlisting in the program. And next year, hopefully, it will, in fact, even grow further. So once we have this cadre of mental health personnel, they are like assistant psychiatrists. And they are going to man the regional psychiatric wings and the district hospitals and eventually the regional psychiatric hospitals. So that is one cadre. Then we also have community mental health officers who are also being trained to be at the grassroots. We have the community psychiatric nurses. So all these are mid-level cadre who will be able to administer mental health care. And then eventually, if you're able to produce more psychiatrists, then they will be there to supervise. Good. We are also talking about psychologists, clinical psychologists. who are very few in the system. But again, the law is going to ensure that we train more of them. So that has been human resource aspect.
Good.
It's effectively been taken care of.
Well, talking about psychologists,
yes.
I hope the authority will be proactive because the Ghana Health Service had been, you know, fiddling over conditions of service for psychologists. Indeed, the University of Ghana has trained a number of clinical psychologists. Unfortunately, although they are willing to work in hospitals and although the Ghana Health Service has a policy that every hospital should have a psychologist, they've not been able to, you know, fashion out job, you know, descriptions for them.
Dr. Samuel say, trust us. As soon as we came, we've written job descriptions for the CPNs, the CPOs, and the CMHOs.
Yes,
and even for the psychops. We are done for the psychops.
Okay.
From the universities, and
yes.
we'll take them on board.
Yes, it's very important.
That's right. And then I was coming to you, Dr. Ohene. Yes. One of our limitations is finance. What would you suggest that we do, apart from the mental health fund that is going to be established? What do you think we can do to make sure that we are able to have funding to manage all these things that we are talking about?
Okay. Well, I think that I don't know how the fund is going to be, what inputs are going to the fund. I would personally be happy with something that does not depend on the whims and caprices of somebody, or that does not depend on look, you talked of a treatment gap of 98%.
That's right.
The problem is huge.
It's huge.
We lack infrastructure, we lack human personnel, so we do need a lot of resources. And I think that if we are going to be moving forward, what we need to do is to ensure that if it's a percentage, Parliament will eventually take the decision.
Yeah, definitely. It's in the LI.
Yes.
The LI has gone, so they have to
give
us dedicated funds.
Yes, having something directly from the consolidated fund, or whether it is a proportion of whatever we all pay as VAT or something, so that it is set aside solely for mental health. Because that is the only way I can see that these resources will be rapidly developed, to be able to at least catch up with the rest of health, let alone what we require by world standards. It's important that we should have dedicated funding. And I think that once people see a good thing, individuals, organizations, both international and local, probably will also chip in to help. But for the authority to be functional and be able to do its work, it must have a line of funding that does not depend on, you know, whether the situation is good or not. Something that comes directly from the consolidated fund.
Akwesi, as you are aware, but for DFID, would have been born still. DFID has given us some money that we've started implementing. DFID was asking, yes, what will be, how will you sustain when we leave you, how are you going to get money? So what is the authority thinking about?
Yeah, that's very important.
Sustaining ourselves.
And I must say that we are really grateful to DFID because frankly, as you just rightly put it, it would have been stillborn. So what we are doing is that once we have the fund established, I'm sure the money you have in the fund will be enough. In fact, will be so huge that you'll really be able to.
Well, there's never enough.
Well, there's never enough. I agree with you.
The gap is very huge.
That's right.
So what the fund will do is that we'll have various sources, various opportunities to contribute into the fund. The main thing, as Dr. Ohene suggested, is actually what the LI says. So there will be levy, either new levy or part of existing levy. Parliament in its wisdom will decide what kind of levy. It may be part of NHIS levy, it may be part of VAT, it may be part of road fund, it may be part of GET fund, or a new levy altogether. I can foresee that a new levy might be problematic. So most likely to be part of existing levy. So that is one. And then the authority can engage in fundraising activities.
Yes.
So you will ask individuals, philanthropists, organizations, benevolent organizations to contribute. So, viewer, listener, watch out. We will be coming to you and ask you to yikakrama, whatever it is.
That's right.
So that will also do a lot.
Right.
And then we can also write
Projects.
grants.
Yeah, grants. That's right.
Indeed, there are a lot of funds existing elsewhere outside.
Okay.
They just want to know where they can contribute to it. So you can write grants, make proposals, and get to this.
Good.
Then development partners may also assist.
Yeah.
But of course, government cannot shirk its own responsibility. So government's own subventions will also be there.
Yeah.
But the fund will not largely depend on that. So these are various approaches.
Before we come to the the asylum issue, let us dwell a little bit on our traditional and faith-based healers. What can we do to salvage our image that, when these visitors come, that these are the places that they go. And then they come to Accra Psychiatric Hospital, and then all the filth in sanitation become more obvious. Yes. So what do you suggest? What can we do?
First of all, it has always been against the law to forcibly chain anybody. Even the old law had it, that you cannot, everywhere. Our constitution does not allow forced imprisonment. So I think that chaining people under the guise of treating them is totally unacceptable. My personal view is that this fact must be made obvious to all the people who treat people and physically restrain them with chains and such, that it is not on. In fact, I would even go further to say that once they are made aware, the police should move in and free some of these people. Because you see, if you are ill and you are taken by your relations to a place against your will and you are forcibly restrained. I've seen people in chains 1 meter long and they stay there for months or weeks. This business of forced starvation, I call it, under the guise of fasting. Fasting should be a voluntary thing. You don't fast because you are incapable of taking decisions and somebody says that you shouldn't eat for 21 days. I think it is wrong. And we should try and stop it as early as possible. I don't think that it will deprive them of the work they do. Basically, what they claim to do is to help to pray for people to deal with the spiritual aspects of their illness. They can still do that. But certainly, in this day and age, I think it is totally out of order that anybody should be chained. And it is against our laws. We should enforce it.
That's it. It's inhumane. Thank you very much. I think actually going to continue with this issue concerning traditional and faith-based healers. Dr. Kwesi, you are an authority in this area. What are we going to do to prevent them from doing harm to our patients?
Well, I add my voice to the point that it's unacceptable in this day and age to be chaining human beings as if they are monkeys.
Yes.
However, I'm not too sure that a sudden radical approach at stopping them will be useful.
Yes.
So I think what we would actually do would be like a gradualist approach. You will first bring them, the traditional faith-based healers, and train them.
Yes.
First, we want to register them all, so you know where they are.
We have an inventory
of all of them, and direction
in
of
all
them.
the districts.
So we know where they are all over the country. And then you'll bring them systematically for training. As part of the training, you get them to understand what the laws say about chaining and not chaining, and the laws of Ghana say about chaining.
When we talk about training, what comes to mind, which other people, some people always ask, these people are already trained, they are traditional healers. What are you going to train them?
You will not be training them to do the spiritual diagnosis.
Okay.
That's right. But you train them to understand that some things are just unacceptable in modern Ghana, and some things fine. You get them to understand what mental illness, psychosis,
and the law actually frowns.
The fact that the law
the people claim they know mental illness.
Fine. So as I said, you are not going to.
I think it's a law you need to educate them on.
Yes, that is very crucial.
Yes.
And then we will then two possibilities, various possibilities. One is that we will put psychiatric nurses there.
Yes.
Once we get them to understand that they can go ahead and pray, but the patients can still be taking their medications, and they accept that point, we can place psychiatric nurses there. And I must say that has even actually started on some pilot basis in some of the areas. So the nurses will be giving them medications to calm them down, and they will still be giving them their prayers, no problem. The only thing you get them to understand, as Dr. Ohene said, that you cannot forcibly keep them away from food in the name of fasting. You are actually starving them. They will need to understand all those things. And then when the patients come and they are very aggressive, again, the nurses would have put there may give sedation to calm them down. After they've calmed down and they want to remain there, that is their choice. If they don't want to remain, the prayer healers cannot keep them there. Yeah. So these are things that will get them to understand. Right. But let me also add that the training is not only going to be directed at the healers alone, it will be directed at our own people. Yes. Our own people will need to understand that they are partners in mental health care. Right. So if a patient decides out of his belief to go there first and come to you later, you cannot frown upon such a patient. Because as at now, if a patient goes there and comes back later, you can imagine how they will receive him. Good. So all these are issues that we put in place. And thereafter, you'll crack the whip if they don't fall in line. And
you are aware that we are going to have the visiting committees. Right. We'll be going there where Human Rights was talking about monitoring. Right. So our allies will be the visiting committees. Right. They'll be going to all those people to see whether the right things are being done. Precisely. Okay, good. Now, Doc, Sami Ohene, we are entering into our last issue. And I hope this should be something that should be discussed by whole Ghana, everybody. Should Accra Psychiatric Hospital be closed down? A hospital that has served this purpose over 100 years and has been the main psychiatric hospital that we have used to train most of our psychiatrists, nurses, social workers, and all that. We want to close it down. What do you think?
I am very clear in my mind what I think should be done. I don't think it should be closed down.
All right.
I think it should be modernized. The immediate reason is this. Some people still have the idea that psychiatry belongs to the outskirts of town. The patient should not be in the middle, they should not be in the mainstream. No. If you have an accident, you can go to the nearest hospital. So why is it that if you have a psychotic breakdown, you cannot go to the nearest hospital in town? What we need is a first-class modern psychiatric hospital in the center where it is right now. If it is built properly with all the right facilities, it should not be a long-stay hospital. I think the long-stay hospitals are the ones that should be elsewhere where there are facilities for rehabilitation, etc., etc. This should be a hospital with modern facilities which admits a small-scale hospital, which can be very properly managed. Okay. And then people will also see that you can walk into a psychiatric hospital and get treatment, just like you'd go to Ridge Hospital next door and get treatment. Okay. I think this is possible. Right. It would mean totally maybe rebuilding some of the structures, refurbishing. Luckily, the hospital has a lot of land. In fact, if you ask me, my recommendation is that you sell off half the land and use the money to rebuild the hospital and, you know, run a first-class facility there.
Somebody was telling me, if you sell part of the hospital, the buyer, is he going to agree to have psychiatric facility close by his property?
It is only if the place looks like it is right now. If you have a first-class hospital, they'll even be happy that they are next door to a first-class hospital. Yes.
Okay, Dr. Kwesi, what's your take on this?
Well, frankly, I agree with him, and that is, I agree with Dr. Ohene, and that is also my belief. And
but we have downsized the hospital from 1,200 to 450.
To 450, and we are going down further.
Why did you do that? Well, if you wanted to stay?
No, the point is that even if it stays, not in the form that it is now. Okay. So we are thinking of two possibilities. One is to completely demolish the structures, to reinforce Dr. Ohene's point, demolish the structures and build a much smaller but state-of-the-art facility.
Where do you get the money from?
So that is one other thing. And so if you realize, so with the mental health fund, if you realize that the funding will be enough to do that, then that will be the choice. If you realize that the fund that you get from the mental health fund is not enough, then you will think of trading off part of the land. But I would say that for now, let's wait until we establish the mental health fund, and then we see how much money we can get. Whether with that we can simply downsize it or we need to trade off. But relocate, especially when people argue that, oh, it's so much in the center of town. There's no reason why you can't have a proper psychiatric hospital in the center of town.
The hospital was there before all
the
the
town,
other places
precisely.
grew. Now they want to send the hospital
And
away.
if you go to Pantan, for instance, come the next 50 years, not even 100 years, Pantan will be in the middle of.
What do you mean
so
50?
every time,
In less than
it's already
20
there.
years, it's already there.
Okay, okay. So, Dr. Ohene,
Yes.
Sami Ohene, what kind of facilities would you want to have at the present location of Accra Psychiatric Hospital?
Well, I want a place where acutely ill patients
Yes,
can come
acute.
in
For short stay.
For short stay.
Right.
Yes. Most people,
Yes.
just like they'll go to any other hospital,
Okay. All right,
maximum
thank you.
2 weeks they are out. And then, you know, you can have all the modern treatments. People can be coming for outpatient ECT treatment, for example. They can be coming for psychological therapies, you know, and it will have its own scanning devices and so on to be able to detect neurological diseases and just what you would find in any state-of-the-art hospital anywhere else.
Yes. Would you think about forensic facility in Accra Psychiatric Hospital?
Again,
a modern
yeah,
type.
all the kinds of facilities that services that we are not providing now, you need to bring them on board. So part of it will be at Accra Psychiatric Hospital elsewhere. So forensic, as you said, in Ghana, you really don't have proper child and adolescent mental health care.
Yes.
So that's another facility that we need to. Geriatric mental health care,
Yeah.
that is another area that. So all
that
this,
one, please, don't bring that one. You do occupy the whole facility.
No,
the whole
I
hospital
don't think
will
he's
turn into
thinking
a
of
geriatric.
old people's home.
No,
Ah, okay.
People who have old, that is, there will be various departments to deal with the different types of
Why don't you want to establish that kind of department at Pantang?
the old people's home.
Yes, not all people's home, geriatric. We
Well,
have
I
a small
think
geriatric.
every hospital
facility.
can
If you
have
want.
it. I mean, if it's it depends. You can specialize in things,
Yes.
and you can have, as he said, I think the child and adolescent is very important.
Yes.
But you can have departments so that when people come, they get specialized care there.
Okay.
I think it will also act as a kind of like a tertiary institution to help the other places, satellite places.
Yes.
If they are having problem with one kind of problem, they know that if they send that person here, you know, something can be done.
Another area that we are not doing very well now is substance use disorders, substance abuse treatment.
The treatment.
We really need to establish proper rehabilitation centers,
Yes.
both within the psychiatric
outside
hospital
in
and
the-
outside,
yes.
very
Yes.
importantly.
Good.
And so those are other areas that we need to be going into.
Okay, my colleagues, too soon, I think our discussion, one is coming, very interesting, is coming to an end. And we have dealt a lot about the Mental Health Act, what we expect, and our challenges that are being addressed, and the work that the Mental Health Authority has embarked upon and will continue to do. And also, we are throwing to the general public for a public debate whether Accra Psychiatric Hospital should be closed down completely and removed somewhere else, or shall we go the softer way of creating smaller but very state-of-the-art facility that will optimize proper psychiatric delivery, commensurate with my eminent colleagues here who are very, very learned and very much qualified as consultant psychiatrists. Yeah, so for the discussions with me, viewers, you had Dr. Akwesi Osei, who was the former chief psychiatrist, currently the acting chief executive of Mental Health Authority, who will very soon be confirmed as the chief executive, and Dr. Sami Ohene, who has been in the area of psychiatry for a long, long time. He has been the head of the Department of Psychiatry, University of Ghana Medical School, and also he is our president of the World Federation of Mental Health and the Psychiatric Association. Thank you very much for your participation. Viewers, my name is J.B. Asare.